Welcome to Senior PsyCare. In this session, we will explore the vital role that quality measures play in ensuring every resident enjoys a high quality of life and receives the best possible care. We will also discuss how these quality measures connect to culture change, resident rights, and ongoing nursing home reform.
In the 1970s, a dedicated group of long-term care professionals united around a common goal: to enhance the quality of life for individuals living in long-term care by promoting dignity, respect, and a sense of purpose. This pioneering effort became known as the Live Oak Project. Around the same time, the National Citizens Coalition for Nursing Home Reform championed the creation of regulations to define and uphold standards for quality of care. Together, these trailblazers sparked a transformative movement called culture change. Their work laid the foundation for ongoing initiatives to improve both quality of care and quality of life in long-term care settings, a mission that continues today, with many original advocates still actively engaged in grassroots efforts.
Ultimately, Congress passed the Omnibus Budget Reconciliation Act of 1987, or OBRA, 87, which includes the Nursing Home Reform Act. The act set up a minimum group of care standards for long-term care facilities that govern how all care providers must operate within communities. There are over 180 sections of requirements, known as tags or F-tags. There are 6 tags directly related to the provision of behavioral health services. There are also tags directly related to the administration of psychotropic medication. CMS defines quality of life as care in a manner and in an environment that promotes maintenance or enhancement of each person's quality of life. Quality of life includes resident rights for dignity, respect, autonomy, and self-determination. It includes their rights for privacy, to take part in their care, and to be free from abuse, neglect, and restraints. Quality of care ensures a person is safe, that their basic activities of daily living are completed, and that care supports hydration and nutrition, skin integrity, prevention of accidents and infections, and access to mental and psychosocial well-being. Nursing home reform and OBRA implemented the use of the Resident Assessment Instrument as a standard of care. It includes the Minimum Data Set, or MDS, as the standardized tool nursing facilities use to gather clinical and non-clinical information about an individual. It assesses cognitive status, pain, mood, behavioral expressions, preferences for customary routines and activities, social drivers of health, and more. The collection of this information is vital in developing person-centered interventions and vital for ensuring quality of care and quality of life. The quality system has a built-in plan to offer action steps to improve quality of care and quality of life in long-term care. Care trends can be identified, assessed, and improved. The Affordable Care Act of 2010 expanded QAPI programs, providing guidance for quality of service and outcomes for the long-term care industry. QAPI is a 2-part acronym. QAPI involves all members, at all levels of an organization. Quality Assurance, QA, and Performance Improvement, PI. Quality assurance helps organizations identify how they are meeting best practices, mitigating risk, preventing adverse events, and promoting a safe environment. Performance improvement is an ongoing process to find areas for improvement. All professionals who work in long-term care should understand the QAPI process and continually evaluate their programs to ensure they meet these requirements and participate in the process. To ensure ongoing participation in quality efforts, CMS has developed a value-based program targeted at improving care for individuals and the population, while offering it at an affordable cost. This system is in place to encourage all facilities and providers to meet and exceed industry-recognized standards. Long-term care communities can participate by minimizing the need for hospital readmissions, averting facility-acquired infections, preventing falls with major injury, and controlling the use of antipsychotics. Facilities and providers can participate by enrolling in the Quality Incentive Payment Program, or QIPP, pronounced QIP. In order to participate, nursing facilities must be a non-state government-owned nursing facility and have at least 65% of their residents receiving Medicaid. Clinicians can participate in one of 2 ways: through the Performance and Merit-Based Incentive Payment System, MIPS, or the Advanced Alternative Payment Model, or APMs.
Every provider is required to participate in MIPS. At Senior PsyCare, all clinicians are registered together as a group, so reporting outcomes impact everyone within the organization. The annual MIPS score is especially important, as it stays with clinicians until the start of the next performance period, regardless of whether you remain employed at Senior PsyCare or move to another company. To meet the requirements, providers must achieve a reporting rate greater than 80% for each year. Clinicians' independence performance ratings for next year will be determined by how you respond to the specific measures this year. MIPS was introduced as a way to streamline and simplify Medicare's approach to quality programs. By consolidating several older Medicare quality initiatives into a single, more manageable system, MIPS represents a significant step forward in Medicare's ongoing transition toward value-based payment. The primary goal behind the development of MIPS was to encourage healthcare providers to deliver high-quality care to patients, while simultaneously ensuring that Medicare reimbursement remains protected. Through this system, Medicare aims to reward providers who focus on quality, efficiency, and positive patient outcomes.
If you bill Medicare Part B, MIPS generally applies to you. While some providers may be exempt based on Medicare volume or participation type, most Senior PsyCare providers fall under MIPS reporting requirements. Provider performance is assessed across 4 main categories: quality, cost, improvement activities, and promoting interoperability. Not all of these require direct provider reporting. For example, the cost category is calculated by CMS using claims data. Senior PsyCare's role is to guide and support providers throughout this process. We offer documentation and coding guidance, conduct educational chart reviews, and help minimize audit risk and potential payment penalties. Ultimately, participation in MIPS can affect Medicare reimbursement and help safeguard your license and billing integrity. MIPS is more than a compliance task. It's about supporting quality care while protecting your Medicare payments, so you can focus on your patients. If you have any questions about MIPS or documentation requirements, SPC's compliance team is always available to assist you.